Hi, I'm Ashley, Senior Clinical Advisor at Carepatron, and I'm here to help guide you through the Ankle Brachial Index. What is an ankle brachial index? The Ankle Brachial Index, or the ABI, assesses blood flow in the arteries of the legs and arms. It compares blood pressure measurements taken at the ankle and the arm to determine if there are any narrowing or blockage in the arteries supplying blood to the legs. During an ABI test, blood pressure cuffs are placed on both arms and ankles. The systolic blood pressure, or the higher number in a blood pressure reading, is then measured and the cuff inflates and deflates to temporarily stop blood flow while the healthcare provider listens. The ankle pressure is divided by the brachial or arm pressure to calculate the ankle brachial index. A normal ABI is typically between 1 and 1.4, indicating normal blood flow. Values 0.9 to 0.99 suggest narrowing or blockage in the leg arteries, which may indicate a risk of PAD or peripheral artery disease. On the other hand, values less than 0.9 can indicate rigid arteries or calcification. It's important to note that the ankle brachial index test is not definitive and should not be used to diagnose PAD. It's only one part of an overall assessment. There are a variety of professionals who can use the ABI, however it is commonly used by doctors and more. Here's how to use the ABI. The first step is to fill in the patient name and date at the top and then read the instructions. The next step is to conduct the test according to what is written. The final step is to interpret results and develop treatment. To view a sample assessment of the ankle brachial index, feel free to visit carepatron.com where you can download and access it for free. You can also access the index through our website and our platform. Simply filter by community or assessment and type in the keywords to find the note. Thanks for watching, and remember to subscribe to Carepatron to view more healthcare videos.